Welcome to Connected Care Education. Today we are going to look at Unit 002, Principles and Values of Health and Social Care Children. Unit 002, Principles and Values of Health and Social Care Children, Learning Outcome 2. Understanding how rights-based approaches relate to health and social care. So we'll start at looking at the key elements of a rights-based approach. So what is a rights-based approach? In relation to the provision of rights-based approach, underpinning this is the Social Services and Wellbeing Wales Act 2014. This is an important piece of legislation about how workers should be providing care and support to children and young people accessing services in Wales. A rights-based approach is ensuring that each child or young person is supported holistically, both in the short and long term. Through using a variety of strategies and co-production working, it ensures that children's rights to health and well-being are being met and that they can fulfil their potential. A rights-based approach involves service delivery that places principles and values as central to all aspects of service planning, policy and practice. For example, social care workers are expected to treat each child and young person as an individual, respect and promote their individual views and wishes, and support their right to have control in their lives and be able to make informed choices. It is a way of providing care that is centred around the child or young person, not just in relation to their health needs. Individual-centred values and approaches ensure that the rights of individuals are upheld and cover the total care of the child or young person. The child or young person is the centre of their care, so they must be consulted and their views must always come first. It includes people's rights, choice, confidentiality, protection, equality and consultation. So how can we provide a rights-based approach? Often carers will be supporting children and young people when they are in a vulnerable position. The quality of care that is received depends on how carers can effectively support and meet the needs of their individual, having a sound knowledge of the individual and what their requirements are. A care and support plan based on a person-centred approach will individualise the care and support each child or young person receives. Person-centred planning involves seeing the child or young individual being supported as the central concern. Carers need to find ways to make care and support individual, not providing the same for everyone. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 1. How can we provide a rights-based approach? Now let's look at how legislation and national policies underpin a rights-based approach. Not supporting a child or young person to make choices or have their needs met is an injustice and may have devastating effects. National legislation, regulations, policies and procedures are in place to promote diversity and to prevent discrimination. They are in place to promote everyone's right to fair and equal treatment, regardless of their differences. For example, the Human Rights Act 1998 covers many different types of discrimination, including some that are not covered by other discrimination laws. Rights under the Act can be used only against a public authority, for example, the police or local council, and not a private company. However, court decisions on discrimination usually have to take into account what the Human Rights Act says. To make Britain fairer and strengthen anti-discrimination laws, the Equality Act 2010 provides understandable practice guidance for employers, service providers and public bodies to ensure that rights to fair treatment are promoted for everyone. The Equality Act 2010 encompasses other acts which all aim to promote fairness and equality and to prevent discrimination. Implementing legislation and national policies in health and social care. Everyone that works in health and social care must ensure that they follow anti-discriminatory practice in their role in working with children and young people. Employees have a duty of care to the individuals they care for, acting in their best interest and challenging any unfair practice, upholding their rights in doing so. A rights-based approach could include religious and cultural choices being respected and an individual having the rights to practice these and be supported to do so. The Office of the Children's Commissioner for Wales has published a framework for working with children, grounded in the United National Conventions of the Rights of the Child, UNCRC. It is a durable approach that withstands social change. It is about placing the UNCRC at the core of a child's experience of education and at the core of school planning, teaching, decision-making, policies and practice. There is a link available for you for more information. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 2, Implementing Legislation and National Policies in Health and Social Care. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 2, Implementing Legislation and National Policies in Health and Social Care. How legislation impacts on a rights-based approach in practice. How legislation impacts on a rights-based approach in practice. Workers must aim to ensure that they provide an inclusive and rights-based approach. In other words, that their practice promotes equality and diversity, does not discriminate, and shows respect for beliefs, choices, cultures, values, and preferences. It is important that workers are aware of their own attitudes and how it may affect their work. If, for example, their interactions with individuals are affected because they label or stereotype them, or hold a negative prejudice against them, they are likely to be accused of discrimination. If they make all the choices for an individual, they are not delivering a rights-based service. Workers must keep prejudices to themselves and maintain a positive attitude towards everyone, regardless of their differences. Workers should be respectful in their approach and show individuals that they value them for who they are. Workers need to build a rapport with children and young people through a positive working relationship. This will ensure that all workers who are working with that individual are fully aware of their beliefs, preferences, needs and values. This co-productive approach will ensure that the individual is receiving a consistent approach to their care. Increasing their understanding of why children and young people think and behave as they do will enable workers to support them appropriately in exercising their rights and meeting their needs. Workers should be able to implement the policies and procedures in practice in order to meet the needs of the child or young person, upholding their rights to fair and individualised care and support. By following relevant legislation and codes of practice, a team can work together alongside other organisations to ensure that each child or young person is having their specific needs met. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 3, Rights-Based Approach. Please pause the video here and complete Worksheet Learning Outcome 2, Worksheet 3, Rights-Based Approach. Advocacy and how it can support a rights-based approach. Advocacy and how it can support a rights-based approach. The role of advocacy. Advocacy is the process of speaking up about an issue that is important to the individual. This can be either self-advocacy, where the child or young person speaks on their own behalf, or citizen advocacy, where a volunteer from a local advocacy group speaks on behalf of the child or young person. Due to the complexity and sensitivity of some issues, advocates would be used with a professional capacity. For example, a solicitor or welfare rights consultant. This form of advocacy does not replace the likes of citizen advocacy or self-advocacy, but works alongside it. Please pause the video here and complete worksheet Learning Outcome 2, Worksheet 4, the role of advocacy. Please pause the video here and complete worksheet Learning Outcome 2, Worksheet 4, the role of advocacy. Now let's look at when an advocate can help. Professionals, organisations and even family carers need to be made aware of advocacy services and how they can support the child or young person. A child or young person may be living in a care or supported setting or with their family and can still avail themselves of an advocate. In all cases, the relationship is confidential to them and their advocate partner unless there is a risk of harm or concerns. All of these activities contribute to supporting a rights-based approach by ensuring a child or young person's voice is heard, irrespective of their communication needs or abilities. Ask an older friend or relative how they think their needs and abilities have changed over the years. Do they need any more or less support or help? Would an advocate help them? Supporting children and young people and their families or carers to make complaints or express concerns. Complaints and concerns. A complaint is an expression of dissatisfaction about employees' actions, lack of actions, or the standard of service provided. A complaint could be one of the following: action or lack of action by the organisation affecting an individual or group, an allegation that the organisation has failed to observe proper procedures, an allegation that there has been an unacceptable delay in dealing with a matter, or about how a child or young person has been treated by a member of staff. Within the health and social care sector, a complaint is an expression of dissatisfaction that requires an investigation and a response. Concerns are softer, not so much of an accusation, and might suggest how an issue could be improved or resolved. The benefits of complaints or concerns. Prevention is most definitely better than a cure in relation to complaints and concerns. A well-organised setting with sound and effective procedures in place, covering a wide range of service delivery and safety expectations, will receive fewer complaints and concerns. Good communication with individuals ensures the information they need is available, and individuals should be aware that they do have the right to complain as they enter the setting and during their time there. Policies regarding health and safety and care provision will all help the smooth running of a setting. They will also reduce the likelihood of misunderstandings or dissatisfaction leading to complaints or concerns. The benefits of complaints or concerns. Prevention is most definitely better than cure in relation to complaints and concerns. A well-organised setting with sound and effective procedures in place, covering a wide range of service delivery and safety expectations, will receive fewer complaints and concerns. Good communication with children and young people ensures the information they need is available, and individuals should be aware that they do have the right to complain as they enter the setting and during their time there. Policies regarding health and safety and care provision will all help the smooth running of a setting. They will also reduce the likelihood of misunderstandings or dissatisfaction leading to complaints or concerns. Please pause the video here and complete worksheet Learning Outcome 2, Worksheet 5, the benefits of complaints or concerns. Please pause the video here and complete worksheet Learning Outcome 2, Worksheet 5, the benefits of complaints or concerns. Supporting individuals and their families or carers to voice complaints or concerns. Support is given to try and resolve complaints and concerns at the earliest stage. This could be by offering advocacy or support to the individual if necessary. They will need to provide, if possible, a clear report of the outcome and information on what to do if the individual is not satisfied with the outcome. Every individual and their family has the right to complain and to be supported to do so. They should not feel uncomfortable in doing so, and this should not impact on the care they receive as a result of raising an issue. Allow time in a confidential area for an individual and or their family to explain their concern. Write down word for word what the issues are in relation to. Make sure that once this information is forwarded to the relevant person within the organisation, that the complaint or concern is followed up and that all parties are informed of the outcomes. And finally, supporting children and young people and their families or carers to voice complaints or concerns. Support is given to try and resolve complaints and concerns at the earliest stage. This could be by offering advocacy or support to the individual if necessary. They will need to provide, if possible, a clear report of the outcome and information on what to do if the individual is not satisfied with the outcome. Every individual and their family has the right to complain and to be supported to do so. They should not feel uncomfortable in doing so, and this should not impact on the care they receive as a result of raising an issue. Allow time in a confidential area for an individual and or their family to express their concern. Write down word for word what the issues are in regard to. Make sure that once this information is forwarded to the relevant person within the organisation, that the complaint or concern is followed up and that all parties are informed of the outcomes.